Welcome back. I wanted to make a quick video for you explaining how the lungs work, the ins and outs of the respiratory system, and kind of touch on some topics that are going to show up on tests like National Registry. So let's get started with the diaphragm, which is a dome-shaped muscle at the bottom of the lungs. Now, there's a reason I'm pointing out that it's dome-shaped, and that's because Registry likes to point it out. So when the lungs are at rest, the diaphragm is dome-shaped. And when we breathe, the diaphragm actually contracts, it pulls the lungs down, and at the same time, the chest wall expands and pulls the lungs out this way. This makes the lungs a lot bigger, and for a brief period of time, they have less pressure than the atmosphere. So that creates a vacuum, which draws air into the nasal cavity. Now, a normal breath is about 500 milliliters, and the term for that is called tidal volume. It's not that complicated. Just tidal volume just means the amount of air that is taken in one breath. The air gets drawn in through the nasal cavity and it runs into these nasal concha. Now, their whole purpose in life is to create air turbulence, and they cause the air to swirl. And as it's swirling, it's picking up heat and moisture before it works its way through the rest of the respiratory tract. And it'll eventually find its way at the back of this airway, and that's called the nasopharynx. And it moves down into the back of the mouth, which is called the oral pharynx, and then the laryngeal pharynx. And then we're going to take a little break because I want to point out something that loves to show up on National Registry, and that's this guy. He's called the epiglottis. Now, I know it doesn't look like it in this picture, but the test love to describe him as leaf shape. Now, what's his purpose? Well, normally when we swallow food, it's going to go down our esophagus right here, and it's going to work its way through the digestive tract. We don't want that food ending up in the airway. So the epiglottis will actually close when we swallow to protect the airway. That's why you can't take a deep breath in while you're swallowing. Go ahead and try it. It didn't work, did it? But the epiglottis loves showing up on tests like National Registry. So moving on, as we breathe in, the air goes through the trachea all the way down the trachea until it gets to this divide. Now we're going to stop here because this guy likes to show up on test too. The divide from the left and right main stem bronchi is called the carina. It's an anatomical position that doesn't play a big function or any function in breathing, but it is something that likes to show up on test. Now, one thing that's not real well depicted in this picture is the angle at which they divide. So the right side of the chest tends to go more straight down, while the left main stem bronchi tends to jet off a little bit harder. And that's because we have the heart to contend with. It's not in this picture, but the lungs have to be a little shaped a little differently to fit the heart in there. Now, normally if we aspirate any kind of food, because this is a straighter shot, it's going to end up in the right lung. Another noteworthy fact that likes to show up on test are the lobes of the lung. The right lung has 3 lobes, upper, middle, and lower, and the left lung only has 2 lobes. And the air continues down, and we're going to jump up to this zoomed up version of the airway until it gets to right here. Now, we need to stop and talk about these guys. They don't play a huge role in regular breathing, but if you're going to learn about any conditions like asthma or anaphylaxis, these are critical. So what are they? Well, this is smooth muscle, and it can dilate to allow more air in, or it can constrict to prevent air from getting down. So you're going to need to know about these if you're going to be learning about conditions like anaphylaxis, allergic reaction, or asthma, because a lot of the medications we use, like epinephrine, albuterol, or breathing treatments, they all work directly on this smooth muscle. Now, I've included a video right here that we kind of touch on some of this. You're welcome to watch that, but I'd encourage you to continue watching this one first. Now the air continues on down and it's working its way through the bronchioles until eventually it finds its way into an alveoli. And this is where the magic happens. But I want to back up and talk about diffusion so we can understand how oxygen leaves the alveoli and goes into the bloodstream. Normal air has 21% oxygen, 78% nitrogen, and about 1% trace elements. Now, the CO2 is what we're focused on, so we're going to write that, but there's a few other gases in there, and it's not always 1%, but we're just going to use that number to kind of sell this concept. So if I breathe in all that inside the alveoli, the patient should have 21% oxygen. Now, do you see this guy right here? That's a blood vessel that's carrying blood that's coming back from the body. It gave up all of its oxygen, or a good chunk of its oxygen, and it's returning to the lungs to pick up more oxygen. Now, typically, they have about 15% oxygen. I told you guys we're going to talk about diffusion. Diffusion isn't that complicated. A lot of students get hung up on it, but it just means a gas moves from an area of a higher concentration to an area of lower concentration. So think about two separate rooms, and they're separated by a door, and one room is filled with smoke. Then you open the door. Where is the smoke going to go? Well, of course, it's going to go into the room without smoke. That is diffusion. A gas will move from an area of higher concentration to an area of lower concentration. Now, here in the alveoli, we have 21% oxygen, and in the bloodstream, we have 15% oxygen. So that oxygen moves from the alveoli into the bloodstream. Now, this returning blood's also bringing an exhaust from the cells. So the cells take the sugar and the oxygen they receive, and they create something called CO2. Now, I'll switch over to green to represent CO2. We already talked about it up here. We got about 1%. So when we have this air in the lungs, we have about 1% CO2. These blood vessels that are returning to the lungs have about 4.5% CO2. So the same thing that happened with the oxygen is going to occur with CO2, just backwards. With the oxygen, we had a higher concentration of oxygen in the alveoli, 21%, so it moved into the bloodstream, which only had about 15%. In this situation, we have 4.5% CO2 in the bloodstream, so we're going to move into the alveoli. And at that point, the diaphragm's going to relax again, which is going to make the lungs get smaller. And that's going to temporarily increase the pressure to where there's more pressure in the lungs than the atmosphere. And then the patient's going to exhale. And the CO2 is going to move out. And that's how we breathe in oxygen and breathe out CO2. I really hope this helped, and I'll see you guys next time.